Hey YouTuber, I want to continue our grad nurse jobs that you should not overlook. And so today we're going to talk about here's the story. You just got out of school. The competition to find the right nursing job is fierce. You're competing with your classmate. You want to see who get the better job, who get the job of their dream. Working in the ER, working in critical care, working in OBGYN, labor and delivery. Don't worry. You will find the ideal job for you. It may not be your right location, not going to be the right time, the right shift, the right money that you are expecting nurse to make, a lot of money, or the right setting. I'm here to clear up the myth that nurses, new grad, may think. Money, do not think about the money when you just got out of school. And I'm saying that because nurses do not see their salary at a level that is respectable pay until after 5 years. You're considered a seasoned nurse. So you have to have a little patience. I want to clear up the knowledge, clear your head out, give you some knowledge, give you pathway to hidden experience, and get your skill up to par so that you get in the hospital if that's your goal. Which these alternative jobs you'll find will build up your skill, teach you about work ethics, and you have to stick with it. Don't quit. Please stay tuned. At the end of this section, I have a special warning for you. One of my mistakes. I hope that will help you to reconsider. One of the jobs that is often overlooked is mental health, psychiatric nursing. In the hospital, if you're looking for that job, it might be on the behavioral health nurse, psychiatric nurse, mental health nurse, or nursing. Psych nurses for the longest has been getting been seen by the average nurse as not really a nurse. They don't consider us, because I am a psychiatric nurse, that we are one of the elites. We don't get the pay that we deserve because no one recognizes us. For the past few years, we're put way down on the lower pole, so you might overlook that kind of career. But I do encourage you to give it an opportunity, give psychiatric nurse an opportunity to see if you like it. I came into the psych position through working as a correctional nurse for many years. And in correction, once again, that's one of the jobs that are overlooked. I work around a lot of inmates. Some has major psychiatric problems, mental disorders, depression, worse, schizophrenia. I can't even pronounce it. Lord. Schizophrenia. They're sociopathic, narcissistic, criminal. I work on forensic unit, and those people are major have diagnosis of psychotic disorder. Why I would consider you to try this position, because sometimes hospital has mental health department, and you could start off there, and then after a year or maybe 6 months in the hospital, if you choose and you don't like it, you can always put in a transfer if they'll let you to another unit. But that's, you want to get your foot in the door. But I guarantee you, you will like psychiatric nursing. It's mostly mental. There's no IVs. So if you want to get that type of skill, I would still recommend med-surg nursing. It's about the mind. It's about depression, dealing with people who are mentally ill. So it's very stressful on that level. So I would encourage new nurses or other nurses, make sure you have a healthy family life, a healthy balance outside of work. Like I said, I did for many years correctional, and I did the psychiatric department in correctional, and I did some forensics. So when I stumble upon a job that says apply for a psychiatric nurse, so I did, and I ended up liking it. And I've worked with the adult, I work with the geriatric section, so that's where my nursing home helped me, working with the geriatric who has Alzheimer's or dementia, and they're depressed. So that, my nursing home experience carry over into my psych, working with the older generation. With the adults, also from working in nursing home, working in rehab center, they have issues of sadness, depression, and other mental health depression besides depression. I had many opportunities during my travels of working with kids that are depressed, and I've worked with kids that are from 5 years old on up to 18, because after 18 they're considered adults, so they would go into the adult units. There's many sections to being a mental health psychiatric nurse. You can work in detox. That detox means people who are going through withdrawal from drugs or alcohol, and you could work on that unit. So with that unit, I think you would get a lot of critical skill, because you have to learn to take the vital signs. You got to learn to determine their vitals. Maybe they have come in with high blood pressure, so you will get a little medical in that detox unit. As far as the older generation, also they come in with psychiatric problems or diagnosis, and also they have medical issues that you need to deal with. They will be in a wheelchair sometime, depend on the facility what they take, but most of them are older generation geriatric. They have a special unit for geriatric psych patient, and it is a lock unit, so you have to have a key to get in and a key to get out, and you got to be very careful with the doors. For a long time I did not like working with sick kids, but I find working with kids who are mentally ill, who has depression, it's very rewarding. I like being a psych nurse, and I think that this should be we should be more getting more respect, as much as the critical care nurse or the ER nurse. We should be on their level, not far as their skill. There's a different skill set, but we should get the same recognition, but we don't. But over the years, when I went to California, I see now that they're trying to get us, get psych nurse up to that level. But overall, the other US, they don't consider it, so the pay will be less. I'm telling you right now, pay for psychiatric nurse is less, even in your travels. want to be a travel nurse, you won't see a lot for psych nurse. So I usually do med surge. My first choice is psych, but I do medical and rehab to come to a combination. Make yourself more flexible to your recruiter. So this should be an experience for you. I think the first, when you get on the floor, as a psychiatric nurse, the typical day is you get your report from the nurse. They tell you who's having difficulty, suicide. Their diagnosis may be suicide ideation, or you might have cutters if you work on the adolescent unit. I went to Minnesota, and the majority of kids coming in, they were cutters. So with cutters, you have to really monitor them. You have to be vigilant about what is bring into the facility, safety issue, things like wire bras. It's not acceptable. So you have to kind of patient teach the family and be careful of what they bring in. Usually on the psych floor, they call them a mental health tech. What I find about the mental health tech, they're not like the CNA. They have a lot of degrees. So don't try to downplay them or disrespect them. I don't even would recommend disrespecting or talk down to the CNA. But a lot of nurses, especially new nurses, do not understand the mental health techs in the psych ward or psych unit. They have a lot of degrees. They have their masters. They're working on getting their PhD degrees. They're but in psychology. So they're there helping the nurse. They will help with groups. They help perform groups. And groups is where you get the kids together, and you might start off in the morning, tell me about your day and what your goal is and how did you, just see how they feeling at the time. And then the evening group is to wrap it up. How did their day go today? And you might talk about the nurse who's doing group, might do a group about medication. Very important. Side effect of their medication. Some medication, they cannot eat that chocolate because it will give them a reaction, a major reaction. Or it's very important in an adult patient to let them know that the alcohol that they have been consuming, they might not be able to consume it with this particular meds once they are discharged. So you're doing a lot of patient teaching, which will help you because you have to do patient teaching every day when you get on the med surge or whatever floor you're doing. The only patient teaching you might get away with not doing is critical care because your patient is really sick. They might not even be responding to you. So that's might be different. But other than that, you're always going to do your patient teaching. In ER, they do it too. What else? So the unit, when I went, what I've seen is a lot of units now on the psych wards, they have LPNs and they usually do the meds. Or if they can't find LPNs, they'll have the RN, one nurse do the medication only, and the other nurse take care of the floor. She does the charting. She's responsible for going into team meeting. And team meeting is you go in and you have the doctor, psychiatrist, you have social worker, you have the case manager, you have sometime the dietitian, sometime the medical doctor, and sometime you have interns or new grad medical students. And you go in and around the table, it's a big table and everybody sit and they go each patient at a time, and the nurse will go over what's going on with the patient. How did the patient sleep? Did the patient sleep all night? Was he up pacing all night? And the doctor is there, so he's met writing. And social worker will say, well, I have a place for him to go. If this person is homeless, they have a place. So everybody collaborate at that table, and then they make a decision. And up on that day, they may decide to discharge the patient. The doctor may decide to change the medication. Dietitian may decide to, based on the doctor recommend ensure. Like I said, in the psychiatric unit, there's several subunit. You could be on the eating disorder unit. Those are kids with eating disorder or adults with eating disorder. You could work on that unit. So you just have to find, if you decide that psychiatric nurses is for you, then what you do is go there and fill out an application. There are psychiatric unit in hospital base. There's also psychiatry unit in the private sector, so that you can, apply. And this will give you some experience, because the experience you're getting is how to delegate, organize your time again, and how to communicate with people who are ill, who are mentally ill. There's certain way, therapeutic way that you have to talk to them. It's very rewarding to me, because one of the things that I like, if I were as working with kids, I feel the joy when I see them get to go home to their parents. And it's okay, because the majority of kids that I work with, you don't get to go to that, back to that loving home. What I hear in the meeting, when we all get together, the social workers say, oh, Johnny mom don't want him back home. And that's sad, because now the social worker job, she has to go tell him this. He's going to act out. He's going to feel depressed even more. He might start harming himself. So we got to be careful. We got to look out for these things. And so when I get to see the parents and meet the parents who are there faithfully supporting their child, and the kid gets to go back home and say, bye, Miss Foster, I'm not coming back. Although some of them come back because they haven't really resolved the issue. And we don't leave the patient family out. Mothers or parents are very active. If they're there, we try to reach out to them. And you can tell the parents that are successful, that really come into the group and join in when they have the family session. One of the biggest difference in working with the adolescents and the little kids that are 5 and up, compared to working in the adult unit, you must get consent. When you work with kids and adolescents, you must get the consent. I don't care how many orders the doctor wrote. Give this, give that. You must get the consent. Parents do not want you to have their child to have Tylenol. Do not want their child to take that psychiatric meds. You must get the consent. If they refuse, you cannot, as a nurse, give it. You will be sued. You will be sued, because they say, I don't want my child. What you can do is let your doctor know, Mrs. Jones do not want her child to have these psychiatric meds. Now, the doctor will only override that if they take it to court, and it's a court mandated that this person could be on the adult unit too, need to take the medication. Then he'll write the order and you can give it. But the biggest difference between the child and adolescent unit and the adult unit is the consent. You must get consent for everything that you do for that child. That is very critical to remember because it might come back to bite you. Because, kids come up, oh, I have a headache. Can you give me Tylenol? And you as a nurse say, so used to giving Tylenol. Yeah, get Tylenol. Mm-mm. You just say, I have to, let me check the record if you can have it. And I look, and if I don't see consent there that the mother said, because the first thing when you do the admission, you're going to call the family and say, call, it's the mother or the dad, and you put another nurse on the phone. So you tell them you're on a two-way. I just wanted to know these are the orders that the doctor order. I want to know if can I give Cynthia these medication, your child? And she may say no, and the other nurse here it's no, so we're not going to give it. And I have to tell the child, your mother didn't approve it, so I can't give you anything until she approve it. So why am I stressing this? Because it's something that you never going to forget if something happens. So before something happened, just don't give it. That's all I can say. Better safe than sorry. I hope that you take my advice and try these alternative jobs. If I'm just starting out, if you're just starting out, don't worry about the money. The money will come. Just get the experience and keep going. I said I was going to tell you about a special thing that I did. I want to talk about the biggest mistake, one of the mistakes I made. I made several in nursing, but this one, job hopping. I know you heard of it. If you didn't, that's when you try to, okay, I'm going to work at this new job, just graduate, just got a job at this nursing home. But in the meantime, I'm going to look for another job. So while you're there, you may be there maybe for a month at the nursing home. You think you got your skill down packed. So you go looking for a job and the other job call and give you like maybe 50 cents or $1 more and you jump to that job. I wouldn't recommend you do it. I wouldn't recommend. Now I see my mistake. What happened I used to do that a lot. I used to jump from jobs to jobs. Hey, they paying, this one paying $5 more, I'm going to do it. Yeah, quit this one and go. The problem is I should have resigned. So this big company, and I don't know what happened. Well, I don't really remember, but I know I had quit. And so when I was looking for a job, this company is in Philadelphia. And so I had moved here to Georgia now. And I had quit that job. And so I see the company had branch out. So that's what you need to be careful. The company branch out. I saw that they had an ad in the paper in Georgia. And I went there and I wasn't able to get the job based on it was still in the record that I quit without giving notice. So the biggest mistake, don't quit the job before you have another job, or don't quit the job thinking that you won't be able to go back, that you're not going to go back, because you never know. These jobs are merging and they keep records of you. It might be a different name, but they still have your record and they'll be able to tell you, well, you used to work for Sweetie Pie and then you quit them and now we're change our name. We're still used to be Sweetie Pie and you quit us. So you got to be careful of that. As far as job hopping, why it will hurt you as a new grad. You don't have any stability. When that recruiter she spent a month at this nursing home and then 2 months at this other nursing home and then 3 months here, you don't have any stability. So when the recruiter look at this, What is she trying? She's jumping around. What is she trying to do? She doesn't seem trustworthy to me. So I would recommend new grad, stick with it for 6 months. It's going to be hard because you're not going to like it if you're not the choice that you want. Not the location, not the shift. You're on night shift and you really want day shift. You're on evening shift and you really want night shift, but you can't. But you got in the door. You're getting some skills. Stick with it. At least I would recommend a year if you can, but 6 months. You can try looking for a hospital job if you get in, but while you're looking for the hospital job, keep your nursing home job. Even if you could go on, if you got hired in the hospital, keep your nursing home as a PRN, and so that you could have that and your reference or your resume for 1 year. You need something for 1 year. The exception to the rule. If you look at my resume, it says that I've been all over the globe every other year. Sometimes I have worked for 2 weeks, worked for a month, worked for 3 months. I have a question when the recruiter asks me, well, in a matter of fact, they see it. It's right there. She's a travel nurse. Her contract ends. I didn't quit. I didn't resign. The contract ends, so I had to move on. So people that does travel nursing, they'll have like sporadic employment on their resume, which is okay. But I always keep a PRN locally to let them know, yes, I'm still working local. I have been there for 2 or 3 years. So I use that as my major. So that's what I want to tell you. Do not job hop so early in your career. Do not make the mistake I did by quitting without resigning. Always resign. Always resign first. If you feel that you want you, because here's the thing. It's not about you feel that you may not go back. Here's the thing. You never know when you may have to go back, because that job may be able to take you back and you want to get some money. So do not exclude by just walking out. Resign. It looks much better than you quit. And so I want to end this, and I hope that you leave a comment if you're still having struggle finding a job in your area. If you're in the Pennsylvania area, I can lead you to the right nursing home health system that has a lot of experience in that nursing home. They have several nursing homes there, and I see that they're branching out in Georgia. Leave me a comment. Thank you for sharing. Thank you for supporting, and have